Okay, today we're going to cover the thoracic and cervical spine. Going to try and keep this brief. We will get into this a lot more detail in semester 4 and semester 1. It's a little bit more superficial. We do want you to be very cognizant of the bony anatomy of the cervical spine. It has bifurcated spinous processes. We also have the canal that runs through here in the transverse processes of C6 through C1, and the artery that basically transcends through that is going to be something called the vertebral artery. And of course, you're going to need to know that. We're going to add some muscles. Now, the thing about this is I don't want you to get too caught up. Try and make your cards somewhat based on what I'm about to say to save yourself some aggravation. The structure in green right now, ligamentum nuchae, has a broad attachment. Make sure you're familiar with it. I'm going to add a layer at this point, and now we get to see the headache that is the cervical spine. All of the deep rotators. These are the transverse spinalis or rotator cervices. I'd like you to know them as the transverse spinalis muscles. They attach from these different regions, C2 and C3, down to C7 and T1, arise from the superior posterior aspect of transverse process of the cervical vertebrae. Wow, very long sentence. From the practical standpoint, what you need to know is that they attach to the posterior transverse process of the cervical vertebrae, and then they pass to the lateral surface of the lamina of the cervical vertebrae, only passing one level north. Your dorsal rami of C3, C8, and there are rotation between adjacent vertebrae as well as stabilization. We come up here, rectus capitis posterior minor, rectus capitis posterior major. You will need to know all of these attachments. Obliquus capitis inferior, and then obliquus capitis superior. In semester 4, we will discuss the suboccipital triangle, and the suboccipital triangle is made up of obliquus capitis superior, obliquus capitis inferior, and the rectus capitis posterior major muscles. These are all very much important to my research, including the rectus capitis posterior minor, as well as treating patients with chronic head and neck, whiplash, migraines, and post-cervical genic post-concussion syndrome. I'm going to rotate the frame to the front, and we are now looking at longus coli. You're going to want to know those attachments. Longus coli has a superior oblique, an intermediate, and inferior oblique. Know the essential attachment points for these. The intertransversaria are very, very simple muscles. They are important for you to know. They essentially go between the transverse processes. That's all you need to know. Between C1, C2, and all the way down to C7, T1. I'm now adding more muscles, so I'm going to keep rotating around, trying to be consistent here. Posterior scalene is the smallest and deepest scalene muscle. It's the posterior tubercle of the transverse processes of C4 and C6, and attaches to the second rib. We've also added the multifidi. Now, the multifidi are a very, very complicated muscle. What you need to know is that there are multiple multifidi muscles. There's deep, mediate, so on and so forth. You'll see that here, deepest, intermediate, and superficial. What I'd like you to know for the simplicity, because you fire one, you fire all three, is that you have the ability of the multifidi, all three heads, to attach from the adjacent vertebrae, i.e. the vertebrae right next to it, all the way up to the third or fourth. What that means is that multifidus controls stability at C7, and then it'll have an attachment at C6, it'll have an attachment at C5, C4, and as far away as C3. Therefore, we can have a large influence by a single motor unit of the multifidi that can affect multiple levels. That's why it's such a deep and important muscle for us as physical therapists. Interspinalis muscle is another muscle you should be aware of. Again, let's keep this simple. It goes from spinous process to spinous process. We've now added another layer. This is the semispinalis cervicis. Semispinalis cervicis arises from the transverse processes and then passes superiorly attached to the spinous processes above. Nerve supply C3 to C5. We now have what primals call a scalenus medius. I will call it the medial scalene. The medial scalene, so the words are the same. One's a little bit Old English, one's a lot easier to understand. So the medial scalene. While we're here, we're also looking at the outer portion of this muscle is called the semispinalis capitis. It blends with the spinalis capitis, which would be from the spinous processes to the occiput. This is the iliocostalis cervicis muscle. And the anterior scalene is another muscle that you're going to want to be very, very familiar with because of the brachial plexus and its association with it. This is longus capitis, another deep neck flexor associated with chronic migraine, chronic headache, and cervicogenic post-concussion syndrome, and the likelihood of developing a concussion regardless of the form of concussion. This is longissimus capitis, longissimus cervicis, iliocostalis thoracis. We are now adding splenius capitis. Splenius capitis, I do want you to look at the broad expanse of that attachment. Very, very important muscle to us. This is splenius cervicis. This is the thoracolumbar fascia, which you're going to hear a lot about as we move forward because fascia is so important to us. We've now added serratus posterior superior. And we now have the rhomboid minor and the rhomboid major, levator scapula, which we've talked about in the past. Some of this should now be a review. We've got the upper traps coming in.